COVID-19. Ahora tenemos 98,030 casos totales confirmados en Illinois. Desafortunadamente, esto incluye 146 personas adicionales con COVID-19 que han muerto, para un total de 4,379 muertes. 18,443 pruebas hechas fueron reportadas en las últimas 24 horas. 8% de esas pruebas fue positivas. Hasta anoche se informó que 4,002 personas en Illinois fueron hospitalizadas y de ellos 993 personas estaban en la unidad de cuidados intensivos y 576 personas estaban en ventiladores. Hay evidencia que el orden de quedarse en casa está funcionando. Es la verdad que todavía estamos viendo casos y desafortunadamente la gente sigue muriendo. Pero imagine que la cantidad de casos y muertes si no hubiéramos implementado una orden de quedarse en casa. Veremos cientos, muchos más casos y muchos miles de muertes. A medida que avanzamos para reabrir, debemos hacerlo de manera segura y deliberada. La decisión de cambiar nuestras vidas no era fácil. Agradezco al gobernador Pritzker por haber decidido firmemente proteger a toda la gente de Illinois por la orden Stay at Home en marzo. Si no se comprometió con nuestra seguridad tan pronto, Illinois no estaría listo para pasar a la fase 3 del plan Restaurar Illinois en unos días. Por favor, escúchame. El virus todavía está presente en nuestras comunidades. Quedando en casa cuando puedan y practicando distanciamiento físico continuará ayudando a detener la propagación de este virus. Imagine fichas de dominó alineadas. Si tumbas el primer dominó, el resto caerá. Sin embargo, si saca una o dos fichas de dominó de la línea, o si las espacia más y tira la primera ficha, el resto de la línea no caerá, porque no hay un dominó para caer. Por favor, debemos continuar siguiendo los datos, lo que ayudará a informar cómo avanzamos y cómo podría ser la nueva normalidad. No deshaga todo lo que hemos hecho y corra el riesgo de regresar. Por favor, hablan con su familia, sus amigos, sus vecinos, sus comunidades sobre la importancia de seguir adelante en nuestra lucha contra COVID-19. Muchísimas gracias. And with that, I'll turn it back over to Governor Pritzker.
Thank you very much, Dr. Ezike. I want to begin my portion of today's briefing with some, frankly, very exciting news. Over the last few weeks, we've seen Illinois make significant measurable progress, and I've been reporting on it to you, in growing our daily testing numbers. And today, we reached another major milestone. Among the most populous states in the United States, Illinois has now overtaken New York to become the #1 state in the nation for testing per capita over the past 7 days. There's much more work to do to advance testing to make it even more widely available, but I do want to recognize at this juncture the folks who made this happen. Of course, IDPH and its lab professionals who are working day and night to process the tests that are given to them. Our raw materials procurement teams, our in-state research university partners, our partner hospitals, health centers, and clinics who are administering the swabs and tests, commercial laboratories, the Illinois National Guard, and of course, the countless healthcare workers doing the patient care right there on the ground. And I'll take this moment to remind everyone who can get a free test at any of our COVID testing locations. Anyone who has COVID-19 symptoms, a cough, shortness of breath, a fever, for example, anyone who has a risk factor, such as a contact with someone confirmed to have COVID-19, or a compromised immune system, or a serious chronic medical condition. Anyone who works in a healthcare facility, anyone who works in correctional facilities, such as jails or prisons, anyone who works as a government employee at any level of government, anyone who serves as a first responder, such as a paramedic or emergency medical technician, a law enforcement officer or a firefighter, anyone who supports critical infrastructure, such as workers in grocery stores and pharmacies and restaurants and gas stations and public utilities, factories, childcare, and sanitation. As testing expands, so too will the criteria allowing more people to get a test. A full list of our more than 250 public testing sites is available on our website at coronavirus.illinois.gov. I also want to update you by letting you know that all 4 regions of the state of Illinois remain on track to meet the metrics to move into phase 3 of Restore Illinois. That's terrific news. Phase 2 of the plan began 18 days ago on May 1st with the reopening of state parks, golf and other outdoor recreation facilities, the opening of garden centers, pickup shopping options at retail stores, the beginning of schools allowing students back in to retrieve personal belongings, and some additional sectors of manufacturing returning to work. And of course, it's been in phase 2 that non-emergency surgeries restarted, which included everything from biopsies to chronic pain procedures to orthopedic surgeries. These reopenings happened for all of Illinois over 2 weeks ago, and they're only now coming to some other states, like in New York, in New Jersey, and California, where curbside pickup at retailers only became available in just the last few days, or golf in Massachusetts, which opened about a week after Illinois. I know that monitoring the various measurements, rules, and regulations across the United States is hard to do, especially if you live in a border city and you see a lower level of precaution just down the road. Believe me, I wish there wasn't such a patchwork of different requirements from state to state. There should have been a national plan. In fact, there was real potential for one. In mid-April, the president unveiled the White House guidance for reopening with explicit public health factors weighed in the mix. Under the president's own plan, Illinois would not reach the next phase until after our current Illinois plan has begun phase 3. But President Trump decided to inject politics in where science and data should have won out, leaving the states to create the patchwork that exists today. Some states have chosen not to listen to the advice of medical experts. There are even politicians in Illinois who ignore science and instead are playing to a small minority who protest at our state capitol. Most of the states with the largest economies have chosen to listen to the science and analyze the data and act according to what will restart jobs and businesses safely. I can say with confidence that here in Illinois, we've committed to operating with a focus on public health and transparent, measurable benchmarks to move to each new phase. For those interested in seeing the data and the metrics, they're updated each afternoon and posted online at dph.illinois.gov/restore. Joining us today are 2 experts in infectious disease control to provide their perspectives. Dr. Richard Novak, head of the Division of Infectious Diseases at the University of Illinois Health System, and Dr. Emily Landon, the Executive Medical Director for Infection Prevention and Control at University of Chicago Medicine, who first joined us in March and inspired so many Illinoisans to help keep each other safe. These 2 doctors have graciously offered their time to update you on the battle against COVID-19, which is still very much alive in the halls of our hospitals and among the population at large. Before I turn the mic over to them, I want to say that I know there are some of our fellow Illinoisans who feel that their lives didn't change much between phase 1 and phase 2, and we're all itching to move ahead. So why can't we just do it now? Well, there's no doubt this is hard. But public health means that each of us is working to protect all of us. It's about our collective impact on each other. And because many Illinoisans are engaged with the reopenings that have occurred in phase 2, it's critical that we observe the full 28-day measurement period before moving forward to phase 3. The good news is that we're just 10 days from that point. And as of now, all 4 regions of Illinois are on track and moving forward into phase 3 before the end of May. As residents, businesses, and employees gear up for phase 3, we will be providing specific safety and mitigation guidelines for workplaces and activities that are reopening. These guidelines have been in development with business owners, employee representatives, and industry associations, including many women and minority-owned operations. And I look forward to sharing more information about that in the coming days. Until then, I'm delighted to hand this conversation over to Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at University of Chicago Medicine. Doctor?
Thank you, Governor Pritzker, for inviting me to join you today. First of all, I want to thank all of you Illinoisans for being sensible, cautious, and selfless in the way that you've approached this pandemic. Some of you have been sick. Some of you have lost loved ones, and many of you have lost jobs. But I know a lot of you will also look back on this and wonder why we had to stay at home since nothing awful happened. But like I said in March, this exactly is the mark of success. It's what a flat curve looks like. It's not perfect. Still, every person with COVID passes it along to someone else who will get COVID. That means our case counts and hospital loads stay stable and somewhat predictable. We would love even less transmission, but this virus is tricky. And even keeping things flat has required huge sacrifices. Now we all realize there will be no swift rescue, no knight in shining armor in the form of a vaccine or an antiviral that will sweep in and return our lives to normal before the summer comes. I'm pretty disappointed about not looking forward to sitting by a pool or going to block parties and taking a vacation. But we need to begin to revive some of our workplaces. And it's not without risk that we do this. Our transmission balance is tenuous, and business as usual could set off another wave of infections that threaten our lives and our livelihoods. We need masks, we need hand hygiene, and we need distance to make this work. And we do need to be all in order to be successful. These cloth masks, like the one I have here, are our lifeline. As you know, people can spread COVID for days before they get sick, or some people may never get symptoms at all, which means that anyone could be contagious with COVID at any time. And these cloth masks don't just help protect you from other people who may be sick, which it turns out some new evidence shows they may be better than we thought they were, which is great news. But they also help to keep your own respiratory droplets inside the mask so that you can't get them onto grocery store boxes or ATM screens. But they're not perfect, and you can't wear them when you're eating and drinking. And that means we have to pair them with keeping our distance and staying home when we can, and keeping our hands clean in order to maintain that tenuous transmission balance that we have. So please, never leave the house without your face covering. And always put it on when you go inside another building or if you're near other people outside. Soon, I promise, it will be as natural as wearing pants, which most of us are pretty good about. I still see a lot of people, though, that don't have face coverings on outside. And it makes me wonder if we're going to be as successful in this next phase as we have been in March and April. I think we can do it. This is a fight against a virus, not an ideology. And I know many of you understand that. A lot of you, almost all of you. And you will take my message to heart. And you'll lead your families, your communities, your neighborhoods, in wearing your masks, in staying home when you don't need to be out, in order to make space for essential workers to be able to get to their essential jobs and for other people to do important tasks. And when you do go out, you'll wear your mask proudly because it says to others that you're not giving up and you're not giving in because you're in this fight to win.
Thank you very much, Dr. Landon. Terrific, and just a message that I know people will take to heart. So very much appreciate your time and willingness to share. I next would like to introduce Dr. Richard Novak, the head of the Division of Infectious Diseases at the University of Illinois Health System. Dr. Novak?
Thank you very much, Governor. I'm very pleased to participate in this conference today to give you both clinical and research perspectives on facing the challenge of the COVID-19 pandemic. Illinois is meeting its goals of expanding the availability and numbers of COVID-19 tests, and the percentage of positive tests is steadily declining, as you pointed out earlier. In the hospital setting, this is reflected by a slow but measurable decline in new hospitalizations and fewer patients in intensive care, as we're seeing at the University of Illinois. The flattening of the curve has prevented the healthcare system from being overwhelmed, and the death rate per capita here in Illinois was much lower than in other states like New York, despite the number of cases that we've seen. This is all a result of these careful measures that we've been taking. We're now receiving shipments of the drug remdesivir, which has been proven to be effective at reducing the severity of the illness, and particularly if it's given before the severity of the illness gets worse. We're not done with this, however. We've launched next phase study combining both remdesivir with a second drug called baricitinib in hopes of further improving on the outcomes of people that we treat. By all measures, it appears we're making slow but steady progress in controlling the pandemic here in Illinois. This has been through careful examination of and response to the data. I know people are tired of wearing masks and social distancing, as Dr. Landon pointed out. You may ask, why do we still have to do this? Masks are very effective at capturing the droplets with virus in them. Surgical masks are maybe a little bit more effective than the homemade mask, but they both work. We call this source control. You're the source, and your droplets are being captured in your mask. South Korea was able to very rapidly control their local epidemic by universal masking, social distancing, and large-scale testing, just as we're doing here, and we're seeing the effect of those measures. As society begins to open up in the coming weeks, we'll need to continue practicing social distancing and wearing masks. I really like the analogy that Dr. Ezike did with the dominoes. We do these things because it protects those around us. We're all in this together, and I wear a mask so that I won't spread the virus to you. You then won't spread it to your family and friends. In turn, I hope that you will do the same for me, and eventually this pandemic will fade to the point where we won't need to do it anymore. We're not there yet. Lastly, the search for new treatments and prevention strategies is moving at an unprecedented rate. Vaccine trials will be starting this summer here in Illinois and elsewhere. I encourage everyone to volunteer and participate in these important studies. The whole world is waiting for the results of these trials. I'm going to don my mask and turn it back over to you, Governor. Go Cubbies.
Go Cubbies. There you go. Go Cubbies. Terrific. Thank you very much, Dr. Novak. And now I'd be happy to take any questions from members of the media, and perhaps the doctors who've joined us might be willing to take questions as well.
We're going to start with online questions today, and then we'll move to our pool reporters, and we'll try to keep it tight here and even between all three of us. So we will start with Christine Herman at NPR. Can Dr. Ezike please elaborate on what exactly it means that phase 3 will allow limited childcare and summer programs open with IDPH approved safety guidance? Has that guidance been made available yet?
Yeah, so we will have more information to come before the end of the week, but we know there are child care establishments that are already open now. And we'll continue to make that available as more and more people will be returning to work. So obviously that need is pressing and more pressing as people are getting ready to return to work. So we will lay out that guidance in just a few days, and we will have more childcare opportunities to address the needs of the communities as they start returning to work.
Jerry Nowicki at Capital News Illinois. The hospitalization numbers all appear to be the lowest since you began reporting daily data on April 12th by a considerable amount. Should we take anything from this, or are we still expecting more volatility in those metrics?
I think I'd like to call on any one of the three doctors, honestly, to answer that question, but perhaps we'll start with Dr. Ezike, and please chime in, anybody else.
Yeah. So I get it is great news, and I'm glad that you noticed that to fall under the 4,000 for the number of people hospitalized. So obviously it's a continuum. People get infected, then they get sick, then if they get hospitalized, then the ICUs and maybe pass on. So it is a good sign that there's fewer people in the hospital, but we have to remember that things are going to start changing. And so we will continue to follow these numbers. And it's why that we need a hard reset and can't just jump from phase 2 to phase 4, because with each phase, we've made changes and loosening things up. And so we want to make sure that these new things that are coming on board, that they are not resulting in a new acute spike or increase. And so that's why we will continue to watch closely, and over the next phase, another 28 days, make sure that these measures that have loosened don't have a spike that will make us want to tamp the brakes a little bit. So we'll be watching that closely, but yes, this is good news. This just solidifies these measures have been working, both the stay at home, both the masking, both the social distancing, all of those things are effective, and that's why we've got numbers that are improving.
If you don't mind, I just want to, Dr. Ezike obviously has said everything important that there is to say about this, but I would just add that the volatility in these numbers is up to us. It's whatever we make it, with the way that we take on and adapt to the changes that we have to make in order to accommodate this virus in our daily lives. So I hope, and I know Illinois can do it.
Hannah, the Daily Line. Governor, lawmakers will return to Springfield this week and vote on a budget based on revenue estimates from Gombe and COGFA that are now about a month old. Are there updated revenue estimates available from your office, and are you asking lawmakers for a lump sum budget in order to make cuts and spending decisions yourself? If so, what can be cut?
The answer to the latter question is no. The answer to the former question is that there have been some adjustments, not major revenue adjustments, but as I mentioned the other day, there's additional spending required related to Medicaid. Now, we believe that that some of the federal funding that will come will alleviate a little bit of that, but to be honest with you, we're including it in the budget because we don't know. And so that additional spending will have to be in the budget, and therefore, we're going to have to make room for it because we have to cover healthcare, especially for COVID.
Chris Carter, WAND News and Decatur. Several malls and businesses are set to open next week. What resources, aside from guidance, is the state offering them, financial, etc., to reopen and ensure public safety?
We're simply providing guidance, and of course, they can get individualized guidance if they need to with IDPH, but we've basically set out, a set of safety rules for them to follow. As we have for a number of industries. We'll be rolling that out over the next coming days.
Janice in Peoria, from the ABC affiliate there. Many Illinoisans are asking for more recovery information. Can you tell us what you know about recovery data and the challenges involved with trying to collect it?
Maybe Dr. Ezike could answer that for us.
Yeah, so I guess, some of the interaction with the patients kind of falls off once they're not in the hospital. And obviously there's a good outcome if they haven't, succumbed to the disease. So we can deduce a lot of recovery data in terms of just seeing people who are not in the hospital and obviously subtracting the people who have unfortunately succumbed to the disease. But in terms of actually talking to all the people, it's just been, a challenge for the teams and the staff who are so busy with the response. But we are trying to get as much information for you. We're definitely going to see how we can put that information on the website going forward. We have been very diligent about doing these email surveys, followed up with telephone surveys, where we were talking to people 14 days after a positive test, 21 days, and 28 days. And we have consistently seen that 70 to 74% of individuals after 28 days following their positive tests have reported that they were fully recovered. So we know.
Safety of Missourians is our first priority. This will always be true for me as governor. And I also said that we must begin to increase our focus on economic recovery as we move forward. When we developed our Show Me Strong recovery plan, we based this on 4 essential pillars to give us a benchmark going forward: testing, PPE, the healthcare system capacity, and public health data. Reopening the economy was especially dependent on healthcare system capacity, and we have met that pillar. The other 3 pillars, we are also critical to reopening, and we continue to monitor those on a daily basis. As I said yesterday, testing will continue to be a priority as we move forward. We have the testing capacity, and now we must find ways to use that capacity to test as many people as we can. Since March the 7th, we have tested over 154,000 Missourians that have been tested for COVID-19. Of these tests, approximately 90% have tested negative. Of the roughly 11,000 positive cases, the vast majority have not been hospitalized and have recovered at home. Today, I think we approximately have a little over 700 people in hospitals in the entire state of Missouri. Within the next week, our goal is to significantly increase our testing numbers by performing 7,500 tests per day. Again, it is critical to understand that the more tests we do, the more positive cases there will be. By increasing testing, we can continue to slow the spread by identifying positive patients and isolating them as quickly as possible. The testing that we're doing today, it seems like every month we're trying to catch our breath with something, how we deal with COVID-19. But the more tests we can do today also prepares us more for this fall. When the school systems open up, when the universities open up, when flu season gets here again, it's important that we do as much testing prior to that so we're prepared for that when people go out in that season and just try to figure out, do I have the flu, do I have the COVID-19? The more that we can do ahead of time, the better off we are. So there's the short-term goal of getting those tests done on a daily basis, but the long-term goal is to prepare for the future of the state and for Missouri to move forward. And as we move forward, testing will be critical to Missouri's full economic recovery and giving Missourians more confidence to be out. Once our testing numbers are up, we can really start to ramp up our focus on the economy. Along the lines of economic recovery, I'd like to talk about the budget today. COVID-19 is unlike anything we have ever faced before. It has had devastating impacts not only on public health, but also the economy and state revenues. As a result, We have to take a hard look at our budget and make some very difficult decisions. As we go through the budget process, as we go to just the remainder of the year, that there will be withholds that will be taking place in the next week to 10 days to get us through just this year. It's important that I get as much information out as I can to where we are financially in the state of Missouri, so people understand the choices that will have to be made and the tough decisions that will have to be made in the near future. Yesterday, I met with my own cabinet members throughout the state to tell them somewhat to expect and start to making adjustments to that, to start putting a plan in each department of what we're going to do as to cut expenses in state government. And everything's on the table to be able to do that. Tomorrow, I will talk to the cabinet member, or to the universities, through DESE, to the community colleges across the state, to explain where I believe the state is going and what we're going to have to do to balance the budget in the upcoming days. I do believe on July 1, withholds will take place throughout the state. I think that the exception to that is if the federal government comes in with more resources and, for better terms, another CARES Act that comes in. But if that doesn't come in, then we are a long way from having the money that we need to move into 2021, and significant decisions will have to be made as we move forward. And I think it's important that we understand that we're the reality of it as of today, so people can prepare. And we are going to be talking that in the next several days and a week, so where we'll be on that. We do have federal funds available under the CARES Act, which will help. But there will still be challenge ahead as we work to recover the economy. As we work through this process, I want Missourians to know that we will be transparent as possible. On April the 10th, I established an informal working group led by State Treasurer Scott Fitzpatrick to help make recommendations on the best use of our federal funding. The working group's second meeting will take place on Thursday. Members of the public can watch a live stream of this meeting on the Treasurer's Facebook page. The Treasurer's Office has also established a web page to provide updates on the working group and the CARES Act funds. We hope that by providing this information and updating the public will reassure Missourians that we are working hard to make every dollar count for the people of this state. Earlier today, I was on the phone with a lot of the county executives around the state of Missouri, county commissioners. Weekly, we're on the phone call with mayors, making sure that these funds are getting out as soon as possible, that are getting the local levels and get distributed out there from that. That's important for us to get that done with the way things are in the state, and we're going to continue to push hard with that. We're going to continue to make sure that the general public, you, the media, know exactly when that money is coming in, exactly when it's going out the door, because it is critical to get it out on a timely basis and get it to the local levels. And I want to thank the state treasurer for the work he's done to put this program together and to be able to make sure that the people out of the state of Missouri know exactly what we're doing with that CARES Act funding. Another department that hasn't been up here, a lot of my directors have been up here early on today. Director Zellers is going to be here to give us a little update with the Department of Revenue, some of the things that are going on in his agency. So I'd like him to come forward and give us a little update. Director?
Thank you, Governor. Good afternoon. I'm Ken Zellers, Director, Missouri Department of Revenue. I want to start by thanking Governor Parson, his staff, and cabinet members for their steadfast leadership and constant advocacy on behalf of Missouri citizens, businesses, and communities. I also want to thank all State of Missouri team members for their unwavering dedication to public service throughout COVID-19. From the very beginning, the Department of Revenue has made every effort to adjust our policies and procedures in a way that allow us to continue serving the people of Missouri while ensuring everyone's health and safety. 2 months ago, the department announced changes related to tax, motor vehicle, and driver's licensing to help ease customer concerns and promote social distancing. We provided automatic special tax relief to individuals and corporations by extending several filing and payment deadlines. including those associated with individual and corporate income tax, to July 15th of 2020. We took steps to help alleviate congestion in local license offices. As a part of these efforts, we granted an automatic 60-day extension for Missouri driver's licenses, non-driver licenses, and instruction permits with original expiration dates of March 1st, 2020 through April 30th of 2020. Vehicle owners with registrations or license plates expiring in March and April were granted an automatic 2-month extension. Individuals with license plates that expired in March of 2020 will have until May 31st to renew their license plates without paying a late penalty at a license office. Similarly, those with license plates that expired in April of 2020 will have until June 30th to renew without paying a late penalty. Although the automatic penalty waiver for title applications expired on April 30th, contract license offices have been instructed to continue waiving title penalties for applicants who were unable to title their vehicle in March or April due to COVID-19. Any customer who wasn't able to title their vehicle in March or April due to COVID-19, but was assessed a title penalty after April 30th, may request a refund by filling out Form 426 and submitting it to Department of Revenue. Now, I'd like to share a bit about where we are currently in our recovery process. We are pleased to report that all but 3 of our more than 170 contract license offices across the state have reopened. These offices are working hard to assist customers safely and efficiently. That said, we know there are a lot of Missourians trying to renew their license plates and driver's licenses at this time. We continue encouraging customers to renew their plates earlier in the month and consider using our online renewal system, which is fast and convenient way to experience the Department of Revenue from the comfort of your own home. We are also pleased to share that 4 of the 6 tax assistance offices have reopened their doors to walk-in customers. These include the offices in Cape Girardeau, Jefferson City, Joplin, and Springfield. Only the offices in Kansas City and St. Louis remain closed to walk-in customers at this time. The department considered factors such as county data and the local stay-at-home orders before deciding to reopen an office. Also on the tax front, we have received and processed approximately 2.5 million individual income tax returns. This is about 358,000 less than the same time last year, but we know this is largely due to the filing extension. Our team members continue working quickly to process returns and, of course, get the refunds out the door. Throughout COVID-19, the department has never stopped looking for new ways to serve our customers. Just last week, we began piloting virtual lobbies in our motor vehicle and driver's licensing division offices in the Truman Building and in the Jefferson City Tax Assistance Office. With this new system, customers can be notified by text when it is their turn to be assisted, allowing them to hold their place in line while waiting in their car, outside the building, or just somewhere where they might feel a little bit more comfortable. We're also regularly working to expand the knowledge base of our 24/7 virtual assistant chatbot, Dora. Since launching on November the 2nd, Dora has provided more than 614,000 responses to customers. We consistently see about 30% of those user sessions occurring during non-business hours. We have a variety of other online resources and services which can all be found on our website at dor.mo.gov. And finally, the health and safety of our customers and team members remain the Department of Revenue's top priorities. We will continue to be flexible, adapt as necessary, and use the data to guide our decisions as we move forward in the recovery phase. Thank you.
Ken, thank you very much. Thanks for what you're doing in your department, and thank all the employees to make sure they know that I appreciate what they do and be working through this whole entire time for what you did. I appreciate that very much on that. Let me just kind of conclude here, and then Dr. Williams is here also for questions today if you have some. But let me just finish up by saying there's no doubt that there will still be challenges ahead, but I want to assure Missourians we are on the right track. We're headed in the right direction. Our economy's coming back, and thank goodness, I'll say it again, we're better off than many states in the United States because of what we represent in this state, because people are really trying to go out there and do the right thing and understand how important it is for people to go back to work. We've got a holiday weekend coming up. It's going to be a big holiday weekend. It's our first one since all this started. Everybody's eager to get outside. But again, I just want to caution everybody to be careful. Use social distancing is a key to the future of this, and it's a future to fight this virus. I know everybody's going to want to get together. You're going to get with your families. Everybody's going to want to be outside. But again, just do it with caution. Use common sense, which I know one thing in Missouri we value very much, and that's just personal responsibility and common sense, because that's what we have to get through this weekend. We got to avoid things like large crowds. You got to be careful about that, over that. And then just keep in mind, this is a critical time for our state. This is going to be the first large weekend that we have. St. Louis just opened back up. Kansas City's opening back up. Our entire state is. We do not need a setback right now. So everybody's got to do their part, and you got to know who's high risk and who's not. And you got to act accordingly to how you're going to conduct yourselves. And I have every confidence that Missouri will do that, and they will stay the course and move forward. So with that, let me just say thank you, and God bless everybody that's listening. Kelly? Ken?
Good afternoon, Director. We've heard from some of our viewers who said that when they have tried to now renew their license plates, that they're being assessed that $50 late penalty, the plates that were due in April when they've gone online. Did you say that they can only renew them in person at this point to avoid that penalty?
Yes, thank you for the question. So the reason that it's only in person is because the way the system is set up online is to automatically charge the late fee. So if they do show up to the office and they tell the office that they were not able to renew due to COVID-19, that they will actually receive that refund right there at the office. They will not be charged at the office.
If they've paid it online, is there a way that they can get that late penalty fee back?
Yes, there is. As I mentioned, I believe it was called Form 426, and all they have to do is go online, get the form, and when you fill it out, at the bottom, there's a little notation at the bottom that asks for the reason. There's like 3 or 4 reasons that are listed, and the bottom reason says not listed above. All you have to do is fill out the reason, put on there, and send it in, and we will refund the money.
Thank you.
Hi, Director. You mentioned that you're still working really hard to get tax refunds out to people. Are you experiencing any bigger delays than you usually would, or is it kind of like business as usual right now?
As far as we're concerned, it's business as usual. We have virtually no backlog. It's about 24 to 48 hours to turn a return around. Of course, there are always those that require a little bit more attention that have to be done manually, but right now, business as usual.
And do you expect that as we get closer to the extended deadline, do you expect that backlog to rise at all, or are you just continuing to see it stay pretty steady?
I expect it to stay pretty steady. I do not expect a backlog. Every year we process right around 3.1 million returns, and we're at about 2.5 million this year. We have about 600,000 to go. We receive anywhere from 40 to 50,000 a week, and we can handle that.
You mentioned that all but 3 of the contract license offices are open. Where are those 3?
Those 3 are located in Cape Girardeau, Olivet, which is a little bit north of St. Louis, and New London, which is about halfway between St. Louis and Iowa on the Mississippi River.
And are you seeing, based on the data you have, are people actually spreading out their appointments, or is this going to create more congestion when they have a new deadline?
From what we've seen, we try to be the model here in Jeff City. They are spreading out. In order to prepare, we were big on making sure that we had a plan. As the governor had mentioned, it's a gradual reopening. And to make sure that we were prepared and we were ready, we had a plan. So what we did was we surveyed all 173 license offices and asked them for their suggestions on how to best ensure the safety of both our employees and our customers. And we put together a list of best practices, and we sent that out to each location. And we actually have people that check on those offices, and from what we're seeing, they are obeying the social distancing and the recommendations that we had on the best practice list.
Thank you.
What type of precautions are you guys taking inside the offices that are already open?
Well, along with the best practices, we did have social distancing. We have by appointment only. We have greeters now that meet you at the door that ask you if you're there for motor vehicle, if you're there for driver's license, to make sure that people don't congregate in any one specific area. Here in Jeff City, in the Jeff City office in the Truman Building, we actually have a staging area. And as I mentioned before, we have the virtual lobby that we can use to make sure that people don't congregate and get too close together. And we monitor the situation. So along with the best practices, ensuring that we're practicing social distancing, appointments, and just practicing general overall good hygiene, I think that we're in good shape.
All right, thank you, Director. Dr. Williams?
Thanks, Kelly. One thing before any questions, I do have a request for you. I was on the phone last night with the pediatricians in Missouri, and also talked to the physicians every Saturday morning. And they've just asked me to talk with you about the fact of how important we think it is to get back into preventive care and to not delay procedures. Especially the pediatricians mentioned immunizations. We would hate it that if because of COVID-19 that you didn't get that, but because you delayed an immunization, that something could happen to your child. So on behalf of them, I really want to encourage people to do their well child visits, well woman visits, and for that matter, everyone to keep up with their physicals. And so anything you could do to help get that message out would be greatly appreciated. So thank you.
Good afternoon, Dr. Williams.
Yes,
some people are thinking about their summer vacations already, and if they travel somewhere and then come back to Missouri, is there any sort of order in place that would require them to quarantine based on where they've traveled?
There is not at this point, although I've been told that about 13 states have something in effect like that. So I would just caution people before they travel to other states that they check out those situations.
I mean, you don't feel that would be necessary here?
We do not at this point. Again, as you know, our numbers are trending down. We always ask that people, many of the airlines require you to wear masks now, and so we would just encourage people to use social distancing and hand sanitizer, whether they're driving or flying or going by train or whatever. So the answer is no.
Hi, Dr. Williams. We saw there's 13 new cases at a Audrain facility, or 13 cases that were linked to a hog farm.
Yes.
And so my first question would be, is the state sending any additional resources or contact tracing? Kind of what is the state doing at that hog farm?
Yeah, I just got off the phone with that. We do a lot of things well, but one we do particularly well is work very closely among the departments. We work well together. So I just got off the phone with Chris Chin, who's Director of Agriculture, and we're aware of that. There's 60 employees there. 13 have tested positive at this hog farm. It shows how important this whole process is to our food chain. So yes, we're working on that now to work with them and to contact them to see how we can help them with that area. That's not a true food processing plant. That's a farm, but it's all part of the chain. So we very much want to help with that.
And is this becoming more of an issue in rural areas? Because we've seen large amounts of cases in the St. Louis region and things like that. Is this now becoming a concern in rural areas? You know what,
as we look at that, you take Saline County, which has a high case ratio compared to the population. When you look at that, they tend to be very closely affiliated with our food processors. If you look at Buchanan, and Montauk and Saline County. And so, yes, and that trend is being repeated nationally. And that's one reason the governor and all of us are so emphatic about increasing our testing, because we think we have to get in to our about 15 food processing plants going forward and doing Sentinel testing and repeat testing, and just very quickly try to identify cases there before they multiply into the 13 cases you're seeing at this hog farm, and obviously the 400 plus cases you saw up at Triumph and Buchanan. So yes.
With about 10% of cases or of tests being positive, is it at all reasonable to extrapolate how many Missourians have or have not had it yet, or do we just not know that at this point?
We don't know, Philip. We're gonna look at that. I'll give you another reason testing is so important. Back to the very first point I made, the governor and I were on a call on Saturday morning, and as you know, they're doing pre-op testing now with COVID-19 for patients who are having non-emergent surgery. And the governor and I were told on Saturday that at one hospital here, out of 1,200 people, only one tested positive. And so that information is very reassuring as we hear that just people coming in completely unrelated to COVID-19, that almost all of them are testing negative. As we're doing our surveillance testing and our community-wide testing, which we're getting ready to do a lot more of, those numbers just give us a great degree of comfort to tell people that you need to reemerge into your health care, that you need to go to the doctor, you need to go get checked out, because in fact, when we check those people who are showing up, the vast, vast majority are negative. The number that we probably look at, and this is not good numbers, but around the country, I think the estimate is in areas that have any kind of prevalence that maybe 1 out of 20 people will ultimately be shown to have antibodies. But I don't want to misrepresent that. That's not Missouri unique data, and that's certainly not robust data at this point.
We were just talking about Sentinel testing. How soon can you expect some of that to roll out across more of the population?
What time is it? We are trying to get on that as quick as we possibly can. Right now, I just left a meeting of 100 people, I guess, in state government, in which we're rolling out. We have 50 long-term care facilities that have one case that haven't finished their comprehensive testing, and we'll be working through the day and tomorrow to get all that done for those. We also very much have a plan going forward for our Sentinel testing, which will be our long-term care facilities, our state employees, our congregated facilities such as meatpacking plants and prisons and jails, even summer camps. And so I think that will be executed by Monday or Tuesday.
All right, thank you, Dr. Williams.
Thank you, Kelly.
Governor Parson?
Yeah, let me just make a quick comment on testing, just to kind of follow up the question you just asked Dr. Williams there. We're going to do more testing. My directors know how important that is. We have a lot of resources in place, and we're going to execute that. And you're going to see that happen on that. Let me say one other thing about this testing, because we all get wrapped around the numbers all the time when we're reporting. So you can kind of spin the numbers however you want to spin them. But the reality of it is, of 154,000 people that we've tested since the beginning of this, probably less than 0.5%, less than 0.5% has been in the hospital of that 154,000. So if you kind of put that in content, you know, I think it's important for people to know that sometimes. I think it's important to know of the 10, 11,000 people that have tested positive, you know, we have less than 1,000 people in the hospital today. We have probably somewhere around 700, but it changes every day. So, you know, as we do the balancing act to get the economy going and making sure we got the confidence of the people out there, you need to understand the majority of the people go home and get over this. They really do, and I think it's important they know that as we move forward. And you need to know, again, I can't stress to you enough, when we just say those numbers are out there, we never talk enough about the high-risk people. And you need to keep reminding them. I think I do, you do as the media, need to make sure the people that are high risk, you need to mention that, hey, you're the ones that really got to pay attention to here, and we got to take the extra steps to protect people. So I think it's important. The numbers, you know, there's a lot of numbers out there, a lot of spin in it, but hopefully we're trying to get that information to you and to the general public every day on really where it stands. The other thing I want to say about testing, St. Louis has got a lot of attention. Good, bad, indifferent, they have because of the situation. But the reality of it is, rural Missouri, just because where they set doesn't make them any less to have an outbreak of this virus as we move forward. It's just smaller numbers. And one thing, rural Missouri, guy coming from that country, you pretty well practice social distancing every day to a certain degree in those areas. But as soon as you start bunching people up in bunches, you can have the same problem that anywhere else can have on a public transit system or any other place. So everybody's got to pay attention here. Just because you live in rural Missouri and there's not been a lot of cases out there yet, it doesn't mean you can totally relax and think everything's going to be fine. Kurt?
Speaking of bunching people up, are you considering canceling the July 4th fireworks at the Capitol? I think Holt Summit today announced, or yesterday announced, that they were canceling. Is that something you've considered?
You know, I haven't talked to the mayor here in town. I mean, it's not even on the radar yet, I guess, fireworks yet. You know, the one thing I would say about firework displays on the 4th of July, I think that would give you an opportunity to practice social distancing. You could still have that and do alternative ways to be able to see the fireworks. But I haven't talked to the city or the mayor about that situation. Again, right now, I'm totally trying to get the economy going back, trying to fight COVID-19, and trying to move forward here in the next week or two, and then we'll figure out those things.
On the withholds for the budget,
yes.
You said you're going to talk with education officials tomorrow. Is that a signal that they're going to take some of these cuts?
Yeah, most certainly. Most certainly. If we don't have the ability to backfill that in some way, and right now I don't believe that is the case under the circumstances we're in. So I'm going to tell them that they need to prepare, and I would say have plan A and have plan B. But look, the schools need to know where we're at in the state of Missouri simply because they got to start working on contracts. School's going to be opening up, and they need to start preparing for that to make decisions. So I think it's important the quicker I can get that information to them so they can make those decisions. But I'm telling you, under the current budget that I know, the guidelines that we have to move forward, about everything's going to be on the table to have to do either withholds or to figure out how we're going to balance the budget.
Hi, Governor. Kind of going off of that, I've spoken with some representatives that they feel pretty confident that we're going to get federal funding. Has that changed for you, or do you have any idea of why?
You know what? I talked to the White House yesterday, the president, the vice president. That was brought up. I was talking to all the governors across the United States. I've talked to the federal delegation, and I just think there's a lot of uncertainty on where that's moving forward right now. There's a lot of things when it comes to that on that CARES Act. There's a lot of things out there. Are you going to bail states out? Are we not going to bail states out? Can you file bankruptcy? All this kind of stuff, But at the end of the day, my view from as a governor is the federal government to help us like they have with COVID-19. But I'm not asking the federal government to bail our state out. That's not their place. I think they can help in the fight with COVID-19, but I want to be real careful when I say that too, to realize I don't want some state over here that's a bad manager and did a terrible job running their states to have an advantage over us that does it right. And a comparison, I know one state yesterday in the media that was out bonding, and the bonds where they were paying like over 5% for bonds because their credit ratings are so terrible. We're in Missouri. Last year we did our bridges and we did our infrastructure. We paid a little over 1% because we take care of our money and we take care of our obligations in the state, and we're going to continue to do that. Look, we can balance the budget, but if we get the economy going, things are going to be better sooner, and that's just it. So you've got to be able to do both. But we can't turn the economy around in the state of Missouri in 30 or 60 days, and it's going to take a while to get us back there. So not to be realistic about this and not tell people kind of the truth of where we're at, we're kidding ourselves for doing that. And that's just not the way I operate. I mean, you got to tell people where we're at.
You mentioned withholds within the next week to 10 days and then again on July 1st. So just to be clear, are you talking more withholds for 2020 and then additional ones for 2021? Correct.
Yeah, the ones that we would be doing in the near future would be just to get us through the end of this year still. We still got a little bit of work to do there. And then 21. We're going to be talking about the budget which just passed.
Just based on the scope of the conversations with departments you're outlining, how would you characterize these cuts? I mean, I know you're probably not prepared to give a number, but is it more than what we've seen so far? Or?
More than we've seen so far as in withholds or in cuts?
Well, either one, I guess.
Well, yeah. That's a little bit of a lengthy discussion. But then again, I would say what's real cuts and what's not real cuts. So the bottom line is we're going to have to look at real dollars real revenue compared to where we're at revenue. And it's a guessing game. Nobody knows what this revenue is going to do. You know, I'm optimistic that I think things in this state could possibly be turned around late third quarter, fourth quarter. I think it will. However, you know, I'm trying to figure that situation out. But right now, I have to prepare that we don't have the means to balance the budget. We don't have the funding to do that right now. So we're going to have to make withholds. And again, I want to be upfront with people about that.
Does that pretty much guarantee a special session on the budget at this point? Or?
Not necessarily. Not necessarily. I mean, the legislators were just here. They did their part, what they thought was a balanced budget. They sent that to the governor's office, and now I have to deal with that. And it's pretty well that simple. And if the money's not in there to be able to do, then I got to do withholds. And at the end of the day, my job is to balance the budget regardless of what anybody else does, and that's what I'm going to do.
Governor, just wanted to follow up with some people who continue to try to access unemployment and get your take on how things are going there. We've had some people say they still had trouble getting through on the phone or being disconnected.
Well, the phone's been an issue, and we're getting better at that every day. But I think you also got to realize 2 weeks ago, probably we was doing about 100,000 claims a week, and now we're down to less than 30,000, you know. So things are getting better on that end. You know, the only thing I can do is apologize for the people that went through that. It's been frustrating to get through that. But again, I can only tell you it's never happened before, and it was overwhelming for a while, and it's just a matter of getting through the system. I hate it if people are out there on a phone for 3 hours. Some of the reports that I get that somebody sat there and they've got cut off and they've got to go through the whole process again. We got to do a better job in that. I mean, that's not what we want people doing. So I know the directors are over there encouraging people to go online to make things to where they can file for the unemployment, things that are a quicker process. I know that's a lot better way to go. But, and honestly, we still get people calling in every day just asking questions. It's not about the claims, it's just trying to get through the system. So it's been challenging. You know, there's no way to sugarcoat that. It's just been challenging. But, you know, we got to do better every day. And that's what we're trying to do, and the director's trying to do that too. All right, thanks everybody for being in today. Thank you.